60% of founders have some type of clinically significant symptom of anxiety or depression. Healthcare is a right that every African should have. A lot of problems in healthcare are more social and political and even business problems.
Hi, and welcome to another episode of the Spotlight Podcast. This podcast is for curious minds and aspiring innovators. We dive deep to discuss inspiring, informative, and offbeat conversations on technology and business. I'm your host, Iwalola Shoboale. I am a passionate advocate for insightful discussions that inspire change and growth. Our guest for today is Dr. Ikpeme Neto, popularly known as Doc Neto. In addition to being a medical doctor, he is an entrepreneur and a health economist with over 10 years of experience in the healthcare sector. Doc Neto is also the founder of WellaHealth, a company that provides affordable healthcare financing options to improve healthcare access and quality across Africa. On the other side of the coin, WellaHealth also helps healthcare providers and insurers reach more clients and serve them efficiently. Welcome, Doc Neto. It's really a pleasure to have you on the show today.
Thank you so much. Huge pleasure to be here. And I've started listening to the podcast and I'm a fan of the stuff you're putting out. Well done.
Oh, I really appreciate that. Thank you. So before we go into the conversation, we have a little icebreaker that we like to play here. I will be sharing my screen. It's a card game, a virtual card game. And you would have to pick a number between 2 and 52. So let me go ahead and share my screen now.
I'm afraid already. I don't do great at card games. I'm picking numbers.
Yeah. So just imagine you're at a friend's games night or something, and you have to pick a card. It's just like a scenario-based question. There are going to be certain scenarios. You pick a number, you read out the scenario, and then tell us what you would do in that scenario. You could really use your imagination and expand on it. Yeah. So just let me know what number you're happy to go with.
This is giving me PTSD. So, at the end of last year, I won Africa's Business Heroes. And this was one of the things actually is, you got to pick a topic. And on stage, these three judges in front of, thousands of people would ask you a very difficult question based on that topic. So
oh my days.
Having flashbacks, but I'll go with number 7, lucky number 7.
Okay, 7. Here we go. Okay, so you could just read out the scenario.
Okay, so you're invited to speak at a TEDx event. What groundbreaking tech topic do you present to inspire the audience? Okay, this is a good question. I have spoken at a TEDx event in the past.
Interesting.
Yes, I did speak about my own personal journey of chasing new paths. So if I was to speak about anything, I think it was very medical focused, this TEDx event actually. And I was trying to encourage the medical students then to not be afraid of going off the beaten track and try to find their own path and creating new things for themselves. So that's what I've spoken on in the past. That's certainly something I'm passionate about. But if it's technology, I think it depends on the audience. I spoke about technology to a medical audience recently, and we spoke about AI. AI is very topical, so it would probably be something around artificial intelligence and the opportunities it provides in healthcare in particular. So yeah, that is what I would pick to speak about.
Interesting. Yeah, I don't think you definitely delivered, so no need to be nervous. So we'll just do one more card. Would you like
one more?
Yeah, one more. Let's challenge you.
Okay, let's do 10.
10. Okay. Oh, great. Please go ahead and read the scenario.
Okay, so you're launching a podcast series. What catchy title and theme do you choose to captivate listeners? Okay, I didn't pick this. I didn't see this card, beforehand, which is interesting because I am actually launching a podcast series.
Oh, interesting. Okay,
yes.
Please tell us more if you can.
And yes, it's still early days, but we're going to call it Against the Tide, and I'll be joined by another quite a well-known entrepreneur in the food processing space. And we'll be talking about kind of some unpopular and unconventional truths about business in Nigeria and Africa. So that is, what the series is about.
Oh, now I can't wait. Unpopular truths. Hey, I'm just imagining the Twitter trends and
exactly. And I mean, this other founder as well is, does get a fair bit of Twitter blowback. So I think it'll be
Okay.
interesting. Yeah. But
How
I
do
mean,
you
we
even
like
handle that?
I mean, I mute a lot of things on Twitter, actually.
Okay.
So
It's
a lot of things
necessary.
I mute on Twitter, and you do have to grow a thick skin. And I think a lot of times I've realized that people's responses on Twitter are them projecting their own personal biases and impressions, and in fact, tone. So some people say, oh, what you said, is very condescending. I'm like, condescending is a matter of tone. Do you know what I mean? So if it comes across as condescending, that is the voice you have put onto that neutral, essentially, tweet. Because I generally don't insult people, and I generally actually try to speak to the facts. So if I come across as condescending, that is actually your own internal voice and you projecting. Because a lot of people actually that know me in person don't have a problem with my tweets because they kind of know that I'm kind, I'm genuine, I'm always looking and seeking for truth. So they usually don't have a problem. It's people that don't know me in person that project and think, oh, he's being negative. And so I just understand that it's people's own internal, voice, and it doesn't really bother me.
Yeah, because otherwise, like you might even be having nightmares based on the way certain people react to your tweets.
Yeah.
Awesome. So we'll get into the main conversation now. I think first of all, most people would like to learn more about you. Could you tell us a bit more about your background? And how did you get here today to be on this podcast?
Yeah, so I started off training to be a doctor. So I went to medical school, trained in medicine, never thought I'd be an entrepreneur, but I think always wanted to solve problems. Me going to medical school was essentially me wanting to have the knowledge to solve medical problems. But then you very quickly realize that a lot of problems in healthcare are more social and, political and even business problems, if you like. And so the ability to know about health and medicine is not enough to solve people's problems. You kind of have to go a step beyond that. And it became very clear to me when I started to look at the problems around healthcare in Nigeria that figuring out how to provide value, how to capture the value, and how to make it sustainable was key to improving healthcare. And so I made that switch into entrepreneurship because that's what entrepreneurship is, how do you find opportunities? How do you create value? How do you capture that value? How do you make it sustainable? And so that's kind of how my journey went from doctor to entrepreneur.
Awesome. So along the line, I've seen your educational background on LinkedIn. Are there any other things that made like a really great impression on you? Maybe books you watched or people you follow, that kind of thing?
So that's a great question. And I think I'm a result of multiple different people, influences, books, and resources. I think one of the big influences that I had in medical school was doing public health. So my public health course was taught by, I went to medical school in Europe, and it was taught by, in my estimation, some rock star public health doctors, because they were the first country in the world the country I studied in, the first country in the world to ban smoking in public places. And that was such a big deal at the time. It had never been done before. And the whole world came to see how it would work. And the guys that made this happen essentially taught me public health medicine. And they kind of, I saw, it gave me belief of what is possible, of what people can do, and how, a group of motivated and hardworking people can make a huge change that has impact for generations. I mean, the rates of cancer came down as a result, rates of, breathing problems came down as a result. And these were just kind of ordinary guys that just, did excellent work. And so that was very inspirational for me. And within that course, there was a book they recommended called The Spirit Level. And that book is a professor of epidemiology who goes through a lot of data to show that equality is the best goal for everybody. So when you have societies that are more equal, both the rich and the poor actually have better outcomes. So they're happier, more fulfilled. And so it became clear to me that, pursuing that equality goal, was something to really look at doing. And so public health, equality started to become a big impact or big influencer in my life as I thought about things. And so again, that led me onto the path of thinking, on a bigger scale, thinking of how business can help and how building things and capturing value can actually bring a lot of good to humankind.
Well, that's really inspiring because actually thinking about it, that would have been something that would have required you would have had a lot of pushback, I mean, in terms of trying to prevent people from smoking in public places. I see movies where pregnant people are smoking without
Exactly.
pay. So I'm just imagining changing that kind of behavior over like 5 to 10 years. That would have been a lot of work.
It
Also,
was, and it taught me. So data. So again, we'll talk about data, but the power of data there, like they did excellent epidemiological work, excellent work, and so they made a difference with the data. But the data actually wasn't enough. What made the data really work was the political will. And so the experts, the epidemiologists and public health guys had put all the data in front of the Minister of Health in the country. And the guy came one morning and said, you know what, we're going to do it. So all the data in the world actually wouldn't have made a difference if the political will wasn't there, and again, we can talk about this later, but ultimately, actually, a lot of the problems we have around, healthcare globally and in Nigeria they are political problems, and you cannot run away from politics ultimately.
Yeah. I actually was going to ask you when you talked about equality in society. So would you consider yourself more of a socialist?
So that's a good question. Where I stand on the political divide depends on, the country and, the system I'm looking at.
Okay.
And because these things are not universal and static. So for instance, when I'm in the US, I'm very left leaning and very socialist, because the US is too right wing, there's not enough state involvement, in my estimation, in a lot of public services in the US. Public infrastructure is poor, public transport, public health, all of those things. And so in the US, I'd say certainly I'd be more left leaning in many ways. Whereas in Europe, where it's more socialist and they're already very left leaning, I'd be more right leaning, where I'd say, taxes are way too high because I pay taxes. Can you reduce that? More personal responsibility. So I'm not too wedded to one identity. I think that these things happen on a continuum, and it depends on what is in front of me that helps me to pick and choose how I will deal with that. I think generally speaking, in Nigeria's case, I think that state capacity is really important. So I will certainly be a bit more left-leaning, so somewhat socialist. So state capacity is really important. There are some services, there are some things that you need the state for. Education, you can't do it without the state. Healthcare, you can't provide it efficiently without the state. So you need a very excellent and efficient state apparatus to do all of that. But then the state shouldn't overstep its boundaries. So the state should enable business and entrepreneurs to then create jobs and opportunities so that people can actually go out and be successful when they put in effort and work.
That's an awesome answer. Like I honestly, I think most people would have answered that question in a very partisan way, but you did. Like you didn't do that. I think that's a great testament to probably all the what would I call it on Twitter, all the debates that you enter into on Twitter.
Exactly. So that's also a problem on Twitter, because you can't classify me, So because one day I might be agreeing with you, but the very next day I might be opposed to you.
Yeah.
And that's because I'm not fixed to an ideology. I feel like ideology sometimes handicap us. We have a hammer and everything is a nail. And so I think of them as tools, is that I have a hammer, I have pliers, I have a saw. So I have all these different tools. And I think depending on the situation, you do need to then apply the right tool. So sometimes, for instance, people have accused me of being a misogynist, and maybe they are right. But if you look, I would say I'm definitely feminist. I believe that men and women are equal, and do have to have equal access.
Okay.
In the practice of that, however, I find that where I depart from, say, some feminists, is that I do think that there are some roles that are maybe not enforced, but ideal based on our biology.
Okay.
And so because of that, people disagree and say, oh, you're misogynist or whatever. But I think that actually, no, it's more so that I believe that there's pressures from evolution and pressures from biology that means that some of us are more attuned to certain things than others.
Okay.
But in practice, again, I be very much men and women are very equal.
Okay. I don't want to ask for examples, because then we'll now start talking about something else, right? Well, let's talk about you. Let's talk about WellaHealth. Could you tell us a bit about your career highlights? What are certain things you look back on and you're like, I did good work there?
So first, becoming a doctor, it's very hard to become a doctor. So I look at that as a huge achievement. Because from when I was a kid, I always wanted to be a doctor. So I look at that as a huge achievement. Going through medical school is very difficult. and coming out of the other end. So I'm always proud of that. The other thing is starting a business. Regardless of how the business turns out, the fact that I started, I'm very proud of that. So I respect entrepreneurs a lot and have a lot of love for them, because starting a business is very difficult. Starting one, employing, about 70 people now, getting to significant revenue, raising venture capital. These are all very difficult things that I'm, really proud that I've done. And so regardless of how things turn out, if, in a couple of years' time, the business fails and we go out of business, I actually think I'm a success, because, I'm less than 1% of the population in what I've done. So I'm proud of everything, so things like winning Africa's Business Heroes, being able to pay people a salary every month, like even the smallest things, I'm really proud of, and humbled as well, of the kind of work that I've been able to do, because it's very, very difficult.
Yeah, I definitely cannot oppose that. It's very difficult. I was on a panel yesterday talking about entrepreneurship, and by definition, at this point, it's all about you're trying to solve a problem and you're going against the tide, because there are already people trying to solve those problems. It's a difficult scenario, and then you're the one person who says, "Oh, let me pick this up. Let me try and solve all those problems and somehow still make money." Yeah. So I definitely see why you'd be proud of that. So can you tell us a little bit more about WellaHealth? What does WellaHealth do, or what do you hope to do?
Yeah, so for us at WellaHealth, the vision is that every African life matters, is of value, and healthcare is a right that every African should have. Good quality healthcare that's affordable. So the way we think about that is helping Africans to access healthcare plans at a very affordable rate. So we provide healthcare plans for common conditions that start at about $1 a month. And we use a network of community pharmacies to help deliver that. As a way to reduce the cost of that care, we use telemedicine as well, so remote doctors to manage that. And we provide that as a service to companies, to enterprises, and even to insurance companies themselves, so that they can reduce the cost of managing their own claims, and they can then reduce the cost of premiums. Because health insurance is quite expensive for the average person on the streets. And if we can reduce the cost of managing that whole process for everybody, then we can bring the premiums down, more people can afford it, and we can grow the industry so that everybody has access to good healthcare without thinking of, oh, how much do I have in my pocket if I'm sick today?
Yeah, that's a big problem you're trying to solve. So what was that first, when was the first time that the idea came to your mind? What did it look like when forming that idea and deciding the direction you were going to go?
So it was never around insurance at all, actually. So when I first started out, a lot of the work that I was doing was around chronic diseases. So my expertise in medicine is around chronic diseases, so diabetes, heart disease, and those sorts of things. And so I wanted to solve that for people, because I had experience with my mom trying to help her solve her own chronic diseases, and found that it was very difficult. So I thought I could do this for more people. But then when you try to do that, you find that the infrastructure for solving that problem doesn't exist. Infrastructure being the connections between healthcare professionals, the payment systems for that, the quality assurance mechanism to do all that well. So I figured out that I have to go and build all of that. So that's what we've done. So connecting, healthcare providers, we have 2,000 pharmacies, for instance, about 100 labs, and many doctors on a platform. So it's one technology platform. All of this is connected. The payer infrastructure. So how do you pay for all of this? So we have embedded, financial technology that enables payments to flow. And we can collect payments from lots of different people. We make it affordable, make it easy for all the payments to flow, the marketing and distribution to enable people to pay, all of that. And then quality assurance. So how are you sure that when you go into a pharmacy to get care, the care you're getting is a good quality care? We provide a whole system to manage all of that. So I had to go and kind of build the infrastructure to do all of this and to solve the problem.
Yeah, so this is a common theme I hear from, I guess, entrepreneurs. I heard the CEO of Shuttlers talking about when they set out to solve the problem of transportation, and then realizing that they actually had to build certain technological infrastructure to get that to happen, right? So with all that happening, with all that going on, you're not a technical person, right? You're not an engineer. So how has that been, formulating the team and getting it to where you are today?
Yeah, I've been very lucky. I've met, really great people. So we've got, my first CTO was actually a friend of mine, Australian guy, but he ended up leaving, and he was kind enough to help transition to the new person. who came on. He just finished university, and so we took a chance on him. And I think that's a theme. I just take a chance on people because I'm also taking a chance on myself. So took a chance on him, and he's just grown from strength to strength over the years. And he's an excellent engineer now and leads our whole engineering team. That's been a theme. It's just taking a chance on people, helping them learn, investing in them. I've had people that have 10x, 20x their pay in the last sort of 6-7 years. And obviously their role has also, grown. People that, came in after NYC and are now managing teams of say 5 or 10 people. That's been a constant theme. It's just taking a chance on people. And honestly, being lucky, like I said, I don't have any secret sauce. I just, trial and error, and then, God smiles on me. We find the right people and we're able to create magic together.
That's amazing. Am I able to also shed some light on like your operational processes? What does that look like behind the scenes?
Behind the scenes, yeah. So it can be fairly complex. So a lot of our work is interfacing with health insurers. So we work with about 30 health insurers now. So that already gives you a sense of the complexity. Now, each and every one of them have their systems, have their payment mechanisms, have their own, wahalas. So we then have, teams internally that deal with those insurers. So collecting data from them and sending data back to them in the format that they like. So for some of them, it's API driven. Some of them, it's, email. Some is even WhatsApp. So I have a team that interfaces with them. Then we work with 2,000 pharmacies. So again, there's a complexity there. So we have a service team that manages that whole pharmacy network, and a service team that then also routes data to that network. We have an application that makes all of this efficient, at least tries to, but we're in Nigeria, and we know that technology doesn't always work, and people respond to people, so our technology has the backup of people having to reach out, call, follow up, visit, all of those things. And then on top of all of that, we then have, a finance aspect. Like I said, it's embedded fintech. So we have, bank accounts, we're paying. I think every day we pay probably 1,000 different entities, So
yeah, that sounds complex.
Yeah, exactly. Billions of naira flowing through back and forth. Thankfully, there's lots of APIs out there and tools that really help. So we wouldn't be able to do it without our fintech bros. Thank you, fintech bros. But yes, all of that goes back and forth. So yeah, it can be fairly complex. And so we have a lot of people that are always working on making things as simple as possible.
So with all of that happening at the back end, how do you manage to keep your prices so low? Because I've been on the website and I'm like, how is this possible? So are you able to talk about that?
Yeah, but again, it's the technology, right? It's the efficiency of the technology. So there's no way you can do this manually. So routing 2,000 things, data to 2,000 pharmacies, 30 insurers, tens of thousands of patients every day. Like there's no way you can do that without the technology. So that's actually core to the way we do things. And community pharmacies are also core. We like to use them first because they're very efficient, they're cost effective, and they work with us very closely.
Okay. I would like to refer to a tweet that you had tweeted I think like 2 weeks ago, and you talked about how, you're ready to, execution is hard, the ideas are like a dime a dozen, and you're ready to like share openly. So I imagine you probably get a lot of questions, and people might be looking at you as competition, right? What would you say is that one thing that makes you stand out or makes WellaHealth stand out from the rest?
Yeah, so in fact, a lot of people reached out to me after that tweet and said, that's a great way to look at things. But I think it's really important because I think the mistake we make a lot of times is we think that we are competing with each other in startup land. But the reality is that most people have never heard of most of the startups. So where is the competition? And because a lot of us live in this bubble, we live on Twitter, or we live in tech ecosystems, and we think, these things are everywhere. They are not. So I'm always outside, or at least I try to be outside of that bubble and talk to people all the time. And when I do that, I realize that we in the kind of tech and startup ecosystem need to work together more to actually go out into these, the broader space to actually tell people, educate them, bring them on board. Fighting with me over this small 1% of the market is a waste of energy.
You managed to acquire, right? Yeah.
So let's figure out best practices. So we go and figure out the new markets. And a lot of companies, established companies, do this. So big tech competes, Google, Amazon, Facebook, but they actually also collaborate in many other areas. That's what we don't see.
Yes.
Pharma companies, they are very competitive. They spend so much on marketing brand, but they also collaborate a lot behind the scenes. People don't realize because they know that, yes, there's some areas you might compete, but there are other areas that are more, my small money is not going to go far. But if 5 or 6 of us bring money together, we can grow this market. And once the market is grown and established, oh yeah, bring out the knives, let's start fighting.
Yes.
Before then, fighting is very, very foolish. So we compete away the profits a lot of times. And so I'm very open to sharing, The motivation for that particular tweet was somebody was trying to build out an agent network for microinsurance. And I basically gave them a playbook. I said, listen, we had 300 agents. We sold tens of thousands of plans. Here's how we did it. Go and execute. Wow. If you have any problem or questions, come back and ask me. I will answer. The reason is there are tens of millions of people who don't have insurance. If she can go and educate the market, the next time I go, is it not easier for me?
Correct.
It is.
Very accurate.
Why am I hiding there? It's foolish to hide. So I'll give her all my secrets. I'll give her everything. Go. You cannot do this market yourself. You cannot take 10 million customers. It's not possible. Let's be honest. It's not possible. But if they see you, they see somebody else, they see me, then they start to say, okay, who are these people that are always coming? Oh yeah, come and talk to me. You get what I mean? Right. So that's my attitude is, in a lot of markets, we can actually share a lot and break the market together.
Yeah. So speaking of educating the market and breaking into the market, what is the Nigerian behavior around insurance? What have you seen when they first hear about insurance? Like, what's their reaction like?
So lots of people say, education, people don't kind of know about insurance, don't understand it. I think the bigger problem is trust, actually. Okay. Imagine telling a Nigerian that if you give me 1,000 naira today and your car has a car crash next week, I will come and I'll repair your car. And you won't have to give me any money at that time. Lie can't happen. You get so in a very low trust society, but insurance is a trust business.
Okay.
So how do you sell a trust business in a low trust environment? You just can't. It's very, very difficult. So beyond just education is actually trust. And the insurance companies themselves are problematic, if we're being honest, because they don't like to pay claims. The one insurance that most people have is car insurance because that's compulsory. But we know that lots of people just buy this roadside third-party insurance for 5K or 10K or whatever, so they can renew their papers and they go on. So they already see the whole thing as fake.
Yeah.
You get so there's huge problems with trying to overcome that. And then when you now look at say life insurance, which is another compulsory insurance, whenever there's a claim, there's so many they have to investigate. They say, bring this paper, bring that paper. It's like when you're taking the money, you're not asking me this. So now it's time to pay. It's a problem.
Just asking you for your birthright and everything.
Exactly. So all of this, diminishes trust such that people don't want to, because nobody has money just sitting around. So if I don't trust you, I'm not going to give you that money. I'll save it somewhere and pray that something does happen to me. I use God forbid insurance company. And if it does happen, I will use my savings and I'll beg my people and I carry on. So education, yes, but trust is a big, big problem. And insurance companies really struggle to build that trust.
Okay. So in the ideal scenario for you, since I think you touched on how politics came into play in the public health scenario that you discussed earlier. Do you think that's something that would need to happen again in this kind of scenario where maybe health insurance for employees becomes compulsory? Or what strategies or what vision do you see making this happening?
Well, it's already compulsory. So that's not, the law is already there actually. So if you have more than 5 employees, yes, it's compulsory. And in fact, actually, the new law says it's mandatory for each individual to have a state health scheme. So there's now 37 state health schemes that everybody is mandated to have. Now, the question is, how are you going to enforce that? Will you start flogging people on the streets?
Very true.
You can't. Yeah. So a law that is unenforceable is not really a law. Is a wish at best. So it is already mandatory. I think the challenge is still a trust problem, of course, because the government is saying, trust us, the government, with your premiums, and we'll give you health care. We already know that's not it. Like nobody trusts the government.
You said exactly. That's what everybody be thinking.
Yeah, I was looking at a poll recently, and 80% of Nigerians don't trust the government. So,
But are there any people that trust their governments, to be honest?
so some countries more so. Again, I was looking at some countries more so. Nigeria was at the bottom of this list. Some countries do. So Scandinavian countries, for instance, trust their government a lot. Yes. Rwandans trust their government a lot. When you speak to average Rwandans, I've been to Rwanda, and you speak to average Rwandans on the streets, they actually trust their government. The reason is public services work.
Okay.
So our public services don't work. So you'd be foolish to trust the government. And government lives in a bubble that they believe that you must trust them because they are government. It doesn't work like that. You have to earn trust.
Yeah.
And every time you do things that are not by the book, you diminish trust. And so elections, for instance, at the end of the last elections, no Nigerian trusts the government. Look at what happened, right? End SARS, for example, no Gen Z trust the government, right? Yeah. Because we saw what happened. So this is the environment. You're now saying, oh, trust me with your premiums for health insurance. I mean, people are not fools,
Impossicants.
Exactly.
Okay, so what strategies are you working on towards solving this trust problem? Or is it beyond just WellaHealth alone?
Yeah, I mean, the problem is beyond us, but we have to try and solve it in our own way. So what we do is we're paying claims, So our thesis is that the proof of the pudding is in the eating, and the proof of insurance is in the claims paying. So when you have a claim, we will pay. We will make it easy for you. We'll give you a good experience with the hope that you will come back and you will also tell people about it. We saw this with one of our customers. She had life insurance from one of our products, and she didn't know it. She bought health insurance, but there was a life insurance embedded in it. We were trying to reach her for, I think, a separate thing. I forget what, and we couldn't. After a few weeks, she called back and said, oh, I've seen your missed call. What's going on? We said, oh, we've been trying to reach you. Here is what we need. And she said, oh, I'm sorry, my mother died, and I was away in the village for the burial. And we said, thankfully, the agent on the phone was savvy enough and said, oh, you bought a plan for your mother. She's like, oh, that's right. Actually, that plan you bought has life insurance, so we will be able to pay you a benefit since your mother has passed away. The lady was shocked. We sent her that money transferred to her account that day, and she couldn't believe it. She said, wow, you mean something like this exists? It can work? Hey, she now went and brought 2 of her siblings to come and sign on.
Fantastic.
So that's our own plan is, pay claims, people will go and tell the story, and more people come on board.
Yeah, so you're making your customers your brand ambassadors. Honestly, I think even from my own personal experience in my role, that's one of the things that work. You don't need to go and pay any influencer 10 million naira. You pay the claims and your customers become your ambassadors. So everyone within their network, once they say, oh, I had to pay 100,000 naira to sort out one health issue, they're like, you're not insured. I use people and I trust them.
Yeah.
So yeah, that's a great strategy. Absolutely. Okay, could you tell us, you're a numbers guy. So are there any numbers you can tell us around what the healthcare services in Nigeria looks like? What numbers are you working on improving, reducing, let us know what's going on in the healthcare sector.
Yeah, so for insurance, less than about 3% of people have health insurance. Out-of-pocket payments is what all of us do. So over 70% of us paying out of pocket. A lot of that is actually related to outpatient style care. What that means is you don't have to go into hospital. So less than 10%, I think about 6% of us go in as inpatients every year to hospital. But most times, we have malaria, we have a cold, we have a flu, we have, gastroenteritis, so vomiting, diarrhea. And we just want to go to a doctor, get some treatment, or go to a pharmacy, get some care, and go back home. So that's the bulk of the spend. And malaria, obviously, big problem. And that's influenced how we built what we've built, so outpatient based, using pharmacies, using remote doctors, giving you access to diagnostics to the point of care in a pharmacy, giving you quick treatments, early treatments, following you up. And that actually solves something like 60 to 70% of everybody's day-to-day healthcare needs.
That's very interesting. I'm curious, is this all research done by WellaHealth, or where do you access this data?
No, so it's all publicly available stuff. So every sort of 5 or 6 years, Nigeria publishes a document called a National Health Accounts. So people talk, there's not a lot of data in Nigeria. While that is true, there is actually some data, but we don't look into it at all because we're very enumerate people. We don't like looking at data. And it can be boring. It's, if you look at the Nigeria Bureau of Statistics, it's boring, 100-page documents.
All key documents, yes.
But there's some data, and if you dig hard enough, you can find something. So there's a national health account every 5 or 6 years, looks at how healthcare is bought and how money is spent in healthcare. There's surveys, so every, again, 5 or 6 years, Nigeria does a multiple indicator cluster survey, alternates with a thing called a national demographic and health survey, and that looks at insurance penetration, looks at contraception uptake, looks at healthcare outcomes, all those types of things. And then there's also lots of other data sources, research from universities, from different research institutes that exist. So I just spend a lot of time reading all this stuff, and so it's just kind of natural and second nature to me.
Okay, interesting. I also know that you're carrying out some research on the mental health of founders. So are you able to tell us what you've learned? What should founders be doing? What's their health diagnostics looking like?
Yes. So the motivation for that was, so May was Mental Health Awareness Month. And again, data-driven as I am, I thought, I wonder what the rates of, mental health problems are within founders in Africa and Nigeria. And I went to look and I couldn't find anything, and that's unusual, for such a big problem, not to find anything.
Yes.
I was quite worried about it. And if you don't have that baseline academic research, it's very difficult to do anything else. People don't realize that a lot of stuff that happens is built on top of baseline academic research. And if it's not there, it means that it's very difficult to make a case for anything. And so, I thought, well, who better than me to kind of try to figure this out? So started to write the paper and put out some, a survey, and collected about 200 respondents. And I can tell you that it is not looking good at all. I think something like 60% of founders have some type of clinically significant symptom of anxiety or depression. So we are under a lot of pressure, and we are actually not doing a lot about it, unfortunately.
Okay, so does WellaHealth offer any mental health services, or is it in your roadmap?
It is in our roadmap. We don't yet do anything directly, but it's something we would like to do. It's more of a kind of personal passion project for me. And so I do some kind of coaching and mentoring of other entrepreneurs and founders. And big for me, I say to them is, you got to look after your mental health. It's very stressful, it's very difficult. And you cannot grow a business if you're under a lot of pressure, you're burnt out, you're depressed. So mental hygiene, stuff like, sleeping, exercise, diet, eating right, and just having connection with friends and family are really important things you can't neglect. The mistake we make is we think, we can neglect all these things, work very hard, and things will be fine. Not at all. We need to pull away from the work, do these things, and then the work actually goes better.
Yeah, definitely. So could you tell us some of the proudest achievements WellaHealth has seen, or what are like the biggest success stories that you've recorded so far?
Yeah, so I think winning Africa's Business Heroes, that was quite significant. So 27,000 businesses applied and we got first place. So quite a significant feat, and I'm really proud of that. Yes, and again, it's not just me, but my team of people that put in a lot of work behind the scenes to make things go. So really proud of that. But honestly, it's actually the day-to-day work that we do. Like it's incredible. Like I said, every day we're paying thousands of pharmacies, helping businesses grow, helping people gain access to great healthcare, solving those real problems for people. I'm really, really happy about that. And then also the jobs. I think allowing young Nigerians apply themselves to difficult problems and see results, like there's no better fulfillment for me, because I think that is actually, excellent and great to be able to do.
Awesome. So what's your vision for WellaHealth in the next, let's say 10 years?
10 years that we are still alive.
Okay, should we make it 5 years?
So, 5 to 10 years, yeah. So one, we're still alive. Second, we've returned some capital to our investors. So I'm an entrepreneur. I do have external investors. I'd like to have been able to return capital to them, however that looks. And then thirdly, to be across Africa serving millions of people. That would be the vision.
Well, I think you're on the right path towards that. Based on everything you've said, if every one customer brings in 5 more customers for you, yeah, that trajectory is going to double for sure. Also,
it doesn't always pan out, in real life, unfortunately.
Yeah. What would you say have been like the biggest challenges or blockers to that?
Yeah, geez, everything is difficult. I mean, Nigeria building infrastructure is difficult. So, it's people. So it's a people problem. Talent, finding the right people, working with people, partners. It just takes time and effort and energy. Finding the capital to keep you going when you're solving all these problems is very, very difficult. So I'd say those are the two things. And just the lack of infrastructure generally, generally doing business in Nigeria, the government really doesn't help you. So you have to kind of figure things out yourself.
Okay. I think I was anticipating a response around people just not being able to afford healthcare, but it's interesting that that's not what you mentioned. Is that something that you see?
So there's money. So that's the thing. So I can't speak about any other industry, but in healthcare, there is money. Because if you're sick, right,
You can't do anything
you
else.
can't do anything else. You know what I mean? So healthcare in many ways is a great industry to be in. They say it's counter-cyclical. What that means is that, even though the economy is dwindling, healthcare usually still stays strong because if you're sick, you're sick.
Yeah.
And Nigeria, again, I referenced the Nigeria National Health Account. We spend money on healthcare. The last one was in 2016. And back then, Nigerians spent $7 billion out of pocket for healthcare.
Wow.
So the money is there. It's not that the money is not there. The question is, can we convince people to trust us to give us that money? So it's not about money for us. Like, money is there. It's just, can we position ourselves to be the conduit for that money?
Yeah. And I think you see that even if a person is destitute, the one time everyone, even people they don't know, is ready to rally around and provide the money.
Sick? There you go. Exactly.
Yeah. Interesting. So where can listeners learn more about you, WellaHealth? This is a great opportunity to tell people how to, sign up for your services.
Yes, so WellaHealth.com, of course, WellaHealth.com. We also have a USSD code if you're in Nigeria. It's *347*96#. You request a call and somebody will reach out to you and tell you about our plans. Those are the best ways to learn about the plans directly. Also on social media, of course, WellaHealth on Twitter, Instagram. You can find us and reach out to us on those platforms as well.
Awesome. Thank you for that. So before we round up, any advice for industry players? Say I'm a doctor and I'm like, this sounds really interesting. What can I do to get into this space?
Good question. I think so. What I've done, and this is the advice I give to people, is just follow your curiosities. So one is be curious, and second, follow those curiosities. I think that for somebody else, it may not be being an entrepreneur. It might be something else because you kind of want to do things that you're skilled at and things you're passionate about. So just follow your curiosities. Don't be afraid. There's a lot of fear, especially in traditional industries. There's a lot of fear of doing things that are unknown. When I went to my parents and said, I want to do startup, they're like, hey, we sent you to medical school, you want to do startup. Are you okay? So there's that fear, people will put on you. But if you have passions, you feel like you have a calling, go for it. It's going to be difficult. You will lose, but there is nothing like pursuing the calling that you feel you have. You will feel fulfilled, even though everything is falling out or falling apart. You will have that fulfillment. And usually the universe comes together to, put you on the right path. And I believe in God. God ultimately blesses, honest people that put in efforts to follow the desires that he has put in our hearts.
Yes. So just a little segue. Speaking of your parents sending you to medical school, are you one of Ben Carson's kids?
No, not at all. Actually, I haven't read the book. I think I only sort of skimmed it a few years ago. No, I'm not a Ben Carson person at all.
Yeah, I'm sure you've heard where people would have read the book. Maybe their parents give them the book to read, and they're like, "Oh yeah, I definitely want to be a doctor."
Exactly.
Yeah. Awesome. Yeah. So, any final words? Anything else you'd like to share?
No, nothing at this time. Thank you.
Awesome. Thank you so much for your time. And that wraps up another exciting episode of the Spotlight Podcast. Thank you so much, Doc Neto, for an amazing episode and for agreeing to come on the show, really. For our listeners, I hope you also enjoyed the episode. But before you go, feel free to send us questions or let us know what you think about the episode or who you'd like us to bring on the podcast. And of course, don't forget to subscribe to us on YouTube and follow us on all your podcast listening platforms. You can also leave us a review and tell us what you think. We've also been cooking up something really exciting. It's called The Big Move. It's a written content series where we anonymously spotlight those brave people amongst us who have packed up their lives in Nigeria, sold their inverters and generators, and carried their green passports to destinations both known and unknown. If you're interested in receiving these stories in your inbox every 2 weeks, be sure to subscribe to our Substack newsletter at iwalola.substack.com so you don't miss out. Would also love to hear your thoughts on today's conversation. Definitely join the conversation on our social media. And until next time, my name is Iwalola Shoboale. Thank you.